Welcome to my series on demystifying the DSM, where I am going through the DSM book chapter by chapter, disorder by disorder, and talking about what are the diagnostic criteria, what do we do to treat these disorders, and some additional information. This is for both individuals and professionals that are trying to learn about mental health concerns. I'm Cristi Bundukamara, psychiatric nurse practitioner with over 20 years of clinical experience, and I feel like my purpose in life is to train and empower people on a mentally strong journey, which includes learning about mental health concerns. We are currently in the feeding and eating disorder chapter of the DSM, and today I am talking about avoidant restrictive food intake disorder. Blech. A lot of words, but this is it's separate from the other eating and feeding disorders for very specific reasons. Each of these disorders have criteria, and this one has A, B, C, D criteria that you would need to meet to be diagnosed with avoidant restrictive food intake disorder. So the first is that there is an eating disturbance, that there's often a lack of interest in the food, or there's severe sensory problems around eating. Now, I know children who have sensory issues around eating, but if you give them something else, if you replace that food, they will eat it. For avoidant restrictive food intake disorder, there is avoidant restriction of many foods, and they have to have one of these four in that criteria A. They either have to have significant weight loss, have a nutritional deficit related to that, be dependent on a feeding tube because of that, and or there's marked psychosocial functioning problems related to them avoiding these foods. Okay, so this can be diagnosed in children, even in as young as infants. But remember that would not be developmentally appropriate, right? All kids go through stages of not liking certain foods, being food avoidant to certain things. But if you can replace that food, if you can get the nutrients in them, then it is not a behavioral disorder like avoidant restrictive disorder. So remember, all of that is just criteria A. So in our Demystifying the DSM, I talk about each of these disorders have criteria A, B, C, D, or more that you need to meet, and that is just criteria A, that they have some sort of eating disturbance, but that they have either weight loss, nutritional deficits from it, dependent on a feeding tube, or severe psychosocial functioning related to that avoidant disorder. Criteria B is that it's not related to, cultural poverty or foods not being available for enough nutritious content, okay? Criteria C is that it's not anorexia nervosa or bulimia nervosa. Now, it's very important, and we'll talk about those two disorders. There is a very clear psychosocial, psychological impact around body image when it comes to anorexia nervosa and bulimia nervosa. In avoidant restrictive eating intake disorder, they don't have that component. It is an unconscious, maybe a maladaptive coping that is coming forward. And then criteria D is that it is not due to a medical condition. Again, anytime you're dealing with kind of the GI tract, we talk about this in the rumination disorder, we need to get GI involved, make sure that it's not an actual physical problem before we diagnose this avoidant restrictive disorder. But even if there is no actual physical disorder present, we may still need GI, dietitian, primary care doctor involved in the care because we need to do some refeeding. And how we do that is important and obviously needs kind of that collaborative medical component. So how do we treat it? Very similar to the other eating and feeding disorders that I've previously discussed, cognitive behavioral therapy, if the child or adult is capable, and when I say capable, that means they have the ability to have insight into their thought process so that they can change their thoughts in order to change their behavior. And you can have kind of that conversation of, this is a maladaptive behavior. What choices can you make to make that better, right? So if you're talking about an adult with this avoidant restrictive disorder, and maybe that's comorbid with trauma, and this is where I see it often. They don't have anorexia or bulimia, but they have trauma. And that trauma, let's say it was some sort of sexual trauma that included oral abuse, right? That sometimes can be associated, and we need to be able to identify those things. So remember, even though we're going through this DSM disorder by disorder, many of them do not stand alone, or often don't stand alone. And so we should be looking for that, especially if it's an abrupt change. If a child appears to be fine with their eating, and then all of a sudden, they're 12 years old and they stop eating, let's really kind of get to know that child, develop a therapeutic relationship. Let's see if there is some trauma behind this, and it's just, kind of a protective layer or a response to something that has happened to them. That does not by any means say that everyone with an eating disorder has had trauma. That happened to me when I was in my 20s. I was diagnosed with an eating disorder, and I was told that, oh, you must have had trauma. And it was traumatic to try to figure out if I had trauma, and I didn't. And so it's important that we're looking at these things, we're considering them, but we're not, making assumptions until that actually comes out. But look for those things in avoidant restrictive disorder, especially if there's like sensitivities or aversions to certain foods and certain textures, because that could be evidence of trauma. But it can happen as young as infancy with no trauma, okay? So again, it's this maladaptive coping that is kind of coming up as a way to handle whatever's going on in their life. So it could be in isolation, but again, looking for depression and anxiety, are there underlying causes that we actually have psychotropic medications or more advanced treatment for? But if it stands alone, cognitive behavioral therapy or behavioral therapy would be the treatment of choice for avoidant restrictive food intake disorder. So continue to learn. We are going through this demystifying the DSM, and our next video is actually on anorexia nervosa, which is pretty extensive. So hope to see you there.